I hope you're doing fine. I'm Beth Kirago. I'm a nurse midwife working at Kahawa West Jacaranda Maternity. I'm here to talk about the birth plan essential. Feel free to ask any question related to birth, delivery, preparedness, labor. Yeah, when we talk about the birth plan essential, what comes into your mind? For example, I have one question here asked severally by some of our patients, like, can I induce labor naturally? Yes, you can induce your labor naturally without using any medication. And how do you go about it? One, you can decide to do just normal exercises like jogging, walking. You can engage in sexual intercourse with your partner because we trust that whichever the medication that we give to induce labor is equivalent to the sperm that the product ejected by your partner. So you can induce labor naturally without using any medication at home. Medication should be used at the hospital, not at home. Something else to note is for labor to occur, there are hormones that must shift. We have progesterone hormone and we have estrogen hormone. When you're pregnant, there is this progesterone hormone that is very high. It is high so that it can be able to support the pregnancy to term. So it tends to go lower, and when you near delivery, that is from that 7 weeks, it starts lowering the progesterone hormone for labor to occur. And the estrogen hormone goes vice versa. It gets high, so and the progesterone gets low, so that labor can occur. So labor should occur naturally, but when it does not occur, we induce due to other reasons. For example, if your pressure gets high, your blood sugar has been high, or if you become post-date with progesterone hormone not getting lower. Yeah, another question that is severally asked by some of our clients is, what is a birth plan? Remember, we are talking about the birth plan essentials. When we talk of birth plan, is how have you prepared to deliver your baby? How prepared are you as a pregnant woman to deliver this baby? For example, which hospital have you planned to deliver? Don't make decision when it is too late. Plan to deliver at a hospital that you are comfortable, especially at Jacaranda Maternity. We are here to help you. What else you'll need is you prepare naturally, you prepare something, or have somebody who will take you to the hospital in case labor occurs at past midnight and you are a woman. You know, women we are at risk. So have somebody you trust who can take you to the hospital in case your labor comes past midnight. If you don't have means to come to the hospital, let's say like you don't have a car, or you don't have, your spouse doesn't have a means to take you to the hospital, have a number of a taxi driver, or have an Uber app so that you can request and you can be picked and brought to the hospital that you have chosen to go and deliver. Another thing, have something you have saved. Have some money. You can have it cash is the most appropriate because M-Pesa might be hanging at that time. Have something to pay the taxi driver upon arrival at the hospital. Have something you can come and pay for the deposit if you're coming to a private hospital. Come and deposit. So have something that you have saved in terms of cash or in your bank account. Okay, we have said about have a trusted person who can take you to the hospital. Also have a trusted person that you can trust to be a labor companion. This is a person who should support you in labor throughout labor process, and you are comfortable with that person. If you want that person to come into the delivery room when you are delivering, let your midwife know, let the nurses know. The nurse, you'll know the nurse automatically. The nurse will be monitoring you. Let us know if you want this person to be part of the delivery process. If you want them to get into the delivery room, let us know and let your person know. So you also need to have baby essentials. For example, clothes. Clothes are always not offered in the hospital for the baby. So have the baby clothes in 3 sets each. When we say 3 sets, what do we mean? We mean if it is mitten, let's have 3 mittens. If it's onesses, let's have 3 onesses. Let's have 3 vests. Pampers, at least small size, a packet of pampers. If it's fleece, let's have 3 fleeces. caps. Let's have 3 caps. And why do we ask you to bring 3 sets of baby clothes? Immediately the baby is born, the baby is wiped by the receiving nurse, the midwife. One set of the clothes, the baby will be covered with one set of the clothes, and then after 24 hours the baby will be bathed, and the baby will be changed to another set of clothes. So if you have 3 sets of clothes, in between the first set and the second set, you may find your baby has popped and has exhausted the first set of clothes. You may decide to change the baby, or you may end up spending more than 24 hours in the hospital. 24 hours is the maximum number of hours you spend at Jakarta maternity after normal delivery without any complication. If there is any complication, like let's say you have no breast milk, you will end up spending more time in the hospital. Or we say that another complication, like if you have delivered and the mother has developed a complication like bleeding too much, that is bleeding more than 500 mils of blood, will stay more than 24 hours in the hospital and will continue changing your baby. So 3 is the minimum number of sets that we request you to bring to the hospital for your baby. So we need also to tackle on the mother essentials. What do we need you to bring to the hospital when you are coming to deliver? At least you have 2 free dresses, and these dresses you'll use them on the way to discharge home. And these 2 dresses should be easier for you to breastfeed. Mostly we recommend Dellas that are all any dress that you can unbutton on the upper side, or you can unzip for you to attach baby to breast. At least 2 free dresses that are easier for you to breastfeed your baby. We might also need sanitary pads. You can have at least 1 or 2 packets. In the hospital, you will be given 1 packet. That is at Jakarta maternity. We shall give you 1 packet of pads. You can also have just some money, as you have said, some cash money. You might end up needing to buy some pampers. But at Jakarta maternity, mother essentials are just 2 dresses. There are most of the other things that we shall be able to provide. So if I can tackle also on the birth preparedness, I can tackle what we give to mothers when they come to deliver at Jacaranda. We give you 2 basins, one for the mother, the other one for the baby. For the baby, a small one. For the mother is a bigger one. We shall also give the disposable panties, 2 or 3 of them. We also give sanitary pads, 1 packet that have around 10 maternity pads. Those pads, you will use them after water has broken in the hospital. If the water does not break, you'll use them immediately after delivery. We also give a toothbrush, toothpaste. We also give soap, bath soap for the mother and for the baby. We also give petroleum jelly for the baby. You can share both of you, so you may not even need to carry. So what you carry at Jakarta when you're coming to deliver will need you to carry at least 2 free dresses that you will use them upon discharge home. Yes. So so check whether there are questions coming. So if we check on the birth plan, birth preparedness at Jakarta is also to tackle on that. When you come to Jakarta Maternity Kahawes, where do you start? This is a mother who has been in labor, just come to Jakarta Maternity Kahawes. First of all, it depends which stage of labor are you in. It will show you, it will be automatic. If you are in labor, just upon arriving at the gate, tell the soldier will be there welcoming you, tell them you are in labor. Depending on which stage of labor, if labor is expensive, you will be helped to get to the nursing station by a wheelchair. If the labor is not much, it comes and it goes, you can be able to walk to the receptionist. So the receptionist should escort you to the nursing desk. Upon arriving at the upstairs, the nursing desk, you'll find around 3 or 4 nurses waiting for you. One of the nurses will pick you automatically and will ask you several questions. Please ensure that you have the antenatal booklet with you. Don't leave that book behind when you are coming to Jakarta maternity. The first question you'll be asked, where is the antenatal clinic booklet. The next question mostly will be, what has brought you to the hospital? Don't feel frustrated if a nurse asks you such a question, what has brought you? Don't answer by telling them, can't you see I'm in labor? No, you don't answer like that. You should tell them, maybe the water has broken, I'm feeling severe abdominal pain. Imagine you can be telling us you are in labor, but upon examining you, you are not in labor. It is just an infection of the urinary tract infection, of the urinary tract that is disturbing you. So just tell us what has brought you to the hospital. If it is the water that has broken, tell us the water has broken. If it is pain that you have been feeling from the raw abdomen to the back, tell us. I have this raw abdominal pain. If you have got headache, if you have edema, that is inflammation of the lower legs, lower lips, tell us my lower lips are swollen, that's why I have come, so that we can be able to assess you accordingly, according to what has brought you to the hospital. So one nurse will pick you, as you have said, upon going upstairs. Will ask you for the antenatal booklet. Then you'll proceed and ask you a few questions. From there, the nurse will do physical examination from the head to the toe. According to the outcome, even after examining you through a vaginal exam, they'll tell you, have you dilated or not, and then the nurse should guide you according to the statement you came with, gestation age, how many weeks you are. So we treat pregnant women accordingly. You may come and I decide not to admit you because what has brought you to the hospital is not labor, is UTI. I treat the urinary tract infection and then I let you go home and then I tell you which day to come again. So if you come and you're past 36 weeks and water has broken, automatically we'll admit you and plan to deliver you, because when the water comes out, it means the outlet, from the outlet to where the baby is at risk of getting infection, and then the amniotic fluid, if it has broken, it means the baby should follow. The baby should be delivered within 24 hours from the time the amniotic fluid broke. So the nurse will advise you accordingly, according to the physical exam that they have done to you and the complaint that you came with. There are those who will send back to the lab, we complete lab results, then we review them. There are those who will send to the scan, we do a checkup on the scan, then we admit you. There are those who will treat you and allow you home. Okay. I have question from a mother who is asking, does Dufaston cause delayed labor? It is not documented that Dufaston can cause delayed labor, so my answer is no. It is nowhere that is documented in the medical field. So it is no. My due date was 8th March. When is today? Today is 11th. But no pain. What should I do? Thank you. This is a mother we can advise to try do labor stimulation by walking and jogging and engaging in sexual intercourse if you have a partner. And I will also encourage you to come for checkup at Jacaranda Maternity Kahawa West. We examine you and we do a membrane sweeping so that you deliver this baby latest by 41 weeks, because you are now 40 weeks 3 days. So you are due, you can come, we do a membrane sweeping so that we can stimulate labor to occur before week 41, before the next 4 days, that is. My last clinic is 19th this month. Labor inaweza kuja mapema. Yes, we said the progesterone hormone is a hormone that supports pregnancy to term. To term, it means to 40 weeks, then it starts lowering. But the same hormone starts lowering from week 37 when you are terms before that 7 weeks. What do? We expect this baby to be born premature. Mostly it might be due to untreated urinary tract infection. So any mother, you feel any abdominal pain and you are below that 7 weeks, just come for a checkup immediately. We check whether you are having a urinary tract infection. So to this question, it is yes. Labor can come earlier. 36 weeks feeling pain under my stomach and white discharge. Thank you. We said term baby are born from week 7 weeks and above. If you have pain and you are below that 6 weeks, and you are below, if you have any abdominal pain or back pain, and you are below that 7 weeks, it means this pain can lead to labor and the baby will be born prematurely. So you come for checkup, we check whether this discharge you're having is related to urinary tract infection. We treat you, then we allow the baby to maturate until the 7 weeks and above. So you come for checkup, please. We do a urinary tract infection, urinary tract screening. So make sure that you come for checkup at Jakarta Maternity, Kahawa West. Other questions? Okay, niko na ball but sahi nasikia kama hapo juu ya kitovu ni uchungu. Is it normal? So this takes me back to revising on the danger signs in pregnancy. For example, severe abdominal pain or abdominal pain, backache, any spotting or bleeding, blurred vision, dizziness, periorbital edema, that is edema of the face, edema of the lower lips, come for checkup. So if you're feeling abdominal pain and you are pregnant, come for checkup. We check whether it is a danger sign or it is a urinary tract infection. So this person who is asking niko na ball but sahi nasikia kama hapo juu ya kitovu ni uchungu, is it normal? It is not normal. Come for checkup at Jakarta Kahawa West. What is spina bifida? Wow, it's a very good question. Spina bifida is when the spinal cord connects the brain ama uti wa mgongo in Kiswahili. It starts from the brain and to the back, to the sacral region. It is when the spinal cord is not complete. If it is not complete, it means in between the spinal cord, there is an outlet, meaning it is not joining to each other. That outlet is called the spinal bifida. Mostly it is a congenital abnormality that occurs especially in the first trimester. And what do you do to prevent this? Immediately you know that you're pregnant or you know your friend is pregnant, make sure that you come to the hospital so that we can encourage you and start on folic acid supplement. Folic acid should always be taken upon conception until the baby is 14 weeks. It prevents the occurrence of spina bifida. So spina bifida is when the spinal cord is not complete at the middle. Inaachana, there is a space between the upper and the lower spinal cord region. Yeah, and it can be prevented through folic supplements, that is prenatal supplements in first trimester. Is headache normal at 38 weeks? We have said the severe headache, it is not normal when you're pregnant. Any headache, please come, we check your blood pressure and then we'll advise you accordingly. It's not normal. I'm pregnant and my child has knuckle cord. Is it normal? Okay, most of the children can have knuckle cord when they are in the uteruses, so it is normal. It only becomes abnormal if you cannot feel the child moving. I'm very sure a scan was done, and that's when you noted that you have a knuckle cord. If the baby is still moving, it is okay. The baby can even be born with that knuckle cord. But mostly when it is not tight and it is at least 1 time around the neck, you can allow labor to take its part. Don't forget that when you're in labor, we continue monitoring you using the CTG, that is cardiotocograph. We see during contraction how the baby is behaving. So it is normal for a baby to have, most of the babies have knuckle cords. What is knuckle cord? It's when the cord is tied around the neck of the baby. So not all babies with knuckle cords or when the cord is around the neck, not all babies can be born vaginally, but others are born, especially when the cord is just 1 time around the neck and the labor progresses with no major sign, and when the cord is strong, you can deliver normal. Another question? CS mom, we are one, but I still feel pain kwa kidonda, but juu imepona kabisa. Is it something to worry? Oh, it is not something to worry. What happens after cesarean section? You see, these muscles have been
there are nerves that goes around the body. You see, the cut itself, after the cut, the nerves takes time to heal. Nerve will take some more time to heal. So that's why sometimes the CS mothers will feel, especially when the weather becomes cold, or when it is cold, you feel a lot of some pain going inside there. It is very normal, so it's nothing to worry about. We can just cope normally, just take painkillers. Yeah, so it is normal for a CS mom to feel like as if the kidoda is still there, but it heals from inside. It's because of the nerves that we are touched during the cesarean operation. My due date was 10 stroke 11 today. My due date was 10 stroke 11 today. No contractions. Baby movements very strong. Should I wait for labor? We say when your due date is today, it means today you have exactly 40 weeks. And the baby movement is strong. That is very good. Come from membrane sweeping so that you can
stimulate labor naturally. Continue with the other exercises that we talked about so that labor can occur. Ensure that this baby is delivered by week 41. That's why we are saying you come for membrane sweeping at Kahawa West, Jacaranda, so that we can do a vaginal exam to stimulate the labor to occur. After stimulation, within 3 to 4 days, the labor should occur. That is why we encourage you to come at week 40, so that it can give you allowance of 3 to 4 days for labor to occur naturally after membrane sweeping. I am 39 weeks 2 days, and my baby's movements have reduced. Is it normal? I am 39 weeks 2 days, and my baby's movements have reduced. Is it normal? It is not normal. If your baby movements reduces, you should come for checkup. We do a scan and a CPG monitoring so that you can check whether it is normal. So please come for checkup at Jacaranda, Kawa West. Another question? The last question? Okay. I'm a CS mother. We are one, but I still feel pain kwa kidonda, but juu imepona kabisa. Is it something to worry? It is not something to worry. It is because during the cesarean section, there are nerves that passes through there, so they felt they were touched in one way or another, or they were traumatized, and they take time to heal. That's why you are feeling the pain, despite the CS was done long time ago. So there's nothing to worry about. You can take painkillers and don't be afraid of getting another baby. So my due date was today. No contraction, baby movements very strong. Should I wait forever? Please come for membrane sweeping. We do a vaginal exam and we stimulate labor to occur, because this is a baby who should be delivered within the next 7 days. So if we stimulate labor like today, within 3 days the labor occurs naturally. So meanwhile, just do the normal exercises that we checked off. If you have a partner, try having sexual intercourse, jog, walk up and down. Yeah, just normal exercises. Meanwhile, come for membrane sweeping. We do a vaginal exam and we stimulate the labor. That is membrane sweeping. I am at 9 weeks 2 days, and my baby's movements have reduced. Is it normal? Please come for checkup. We do a scan and a midwife check. We check on your heartbeat and we do a CTG monitoring. We check whether the baby is okay. When the movements of the baby reduced, mostly there is a reason why. Please come for checkup. We check whether your baby is okay. It is not normal. Just come. Another question? Guys. My last period was 6th deck. I went to get a scan and they said I'm 15 weeks. How is that possible? Hey. So remember, a scan gives you the age of the pregnancy according to the size of the pregnancy at that moment. I hope you understand what I have said. A scan gives you the age of the pregnancy. Like this one, it is say that you are 15 weeks. at that time. So you want to know how is that possible. It is possible because a scan should give you the size, the age of the baby according to the gestational size. It measures the size of the baby, then it does its own calculations to get the age of the pregnancy. So it is possible. But we said in pregnancy, if you remember your period and you are sure of the last period, it is the most accurate direction to follow. Another question, I consume glucose powder a lot as a craving. Any effects on that weeks? Okay, if you consume glucose a lot, my other question is, have you been checked for the glucose monitoring? That is the OGTT. OGTT should be a client who could have gone for OGTT first. If it was negative, you can just do the glucose. If you have never been tested for the OGTT, we do the test at the facility. Then we check whether you are giving your baby too much sugar. Remember, giving your baby too much sugar, the baby will grow excessively, and for you to deliver normally, it brings you troubles. The baby will not be able to decide during labor. So don't give your baby too much sugar. In fact, I'll encourage you to take normal nutrition uptake. So it can affect the baby. Can any effect? Yes, it can affect the baby by giving the baby too much sugar, causing the baby to get overgrowth or to grow excessively big. So another question, 14 weeks, but I am having a lot of saliva. What can I do? It is normal in the first trimester. Those are changes, that is physiological changes that occur in pregnancy, like having a lot of saliva, feeling nauseated, bloating. Some even will get constipation. Those are expected changes that occur in pregnancy, but not to all mothers. So what can I do? Just try take more water to dilute this saliva, and then understand it is just an occurrence and it will start reducing once you get to 16 weeks. So don't be frustrated by the saliva. It's a change that occurs in pregnancy. Yeah. Another question, I am 4 months, but I feel pain on my right leg. Is it normal? 4 months pain on the right leg. So this one I encourage you to come. We do a checkup. We can do a scan on that leg. We check whether it is clots. Remember, you should not feel pain, especially if the pain is on the around the calf muscles. That is upper, but below the knee, but upper above the ankle. You come, we check, so that we exclude it as a clot. So it is not normal. You come, we check. We can do an ultrasound on the same. Any other question? Good. Do you allow patients to give birth in other different positions, or is it just lying on the back? We do allow patients. Yes, we allow patients to give birth using different positions of their choices. We allow. And those other positions, mostly we demonstrate them during birth preparedness classes. So ensure that you come for those classes so that you can see in real life situation, you can see the other positions that we use to deliver. These birth classes, we conduct them on every Monday between 8 to 2 p.m. between 8 a.m. to 2 p.m. Hey, that's 3 weeks, but I feel too much pain core joints when turning. Is that normal? It is not so much normal, but my question is, are you on calcium supplement? If you're that 3 weeks, you're not on calcium, that's why you're feeling joint pain. Any mother who is pregnant from 20 weeks, please ensure that you're on calcium supplement to reduce the occurrences of joint pain. That means your calcium is getting lower. So let's take calcium. How many weeks will I feel my baby's movement? Thank you very much. You should start feeling your baby movement from week 22. 22 weeks, you feel movement. It starts like butterfly. You feel like there's something touching you from inside. From there, you start feeling kicks. Yeah, especially when you take some water, you feel the baby has kicked. So you start feeling baby movement from week 22. Frequent panic attacks at 17 weeks, sometimes high BP and headaches. This is a patient who should come for gynae checkup. We check you from head to toe. High BP and headaches and panic attacks. You come, we check whether you have any psychological disorder so that we can be able to help you before the pregnancy is comes to term, because before the baby grows bigger, you come, we check, we help you to carry this pregnancy to term, so it is not normal. Another question? I'm 3 months, feeling pain upper chin or stomach. As yes, ma'am. What is the issue? 3 months, is it 3 months post CS, or you are 3 months pregnant and you have a CS car already? So I'll answer the two, because we're talking about this mother who is 3 months post cesarean section and is feeling a bit of pain on the cesarean section site. We have said it's normal post operation to feel the pain because
Is still healing from the scar. There are those scars that heal, but you still feel the pain later, even after 2 years. So it is normal as long as the pain is not intense. Okay, that one I have answered. So the issue is because the healing is still taking place and nerves takes time to heal. There are nerves that goes down there that were stimulated during operation, but they take time to heal. They easily feel the sense of pain. Okay, I delivered on the 27th last month through CS, and my baby called Ijanguka. Is it normal? 27, 1 week is over, and the cord has not yet fallen. But it is very normal. You just continue cleaning the baby, normal cleaning with warm water. It is normal. It will fall. It depends with how strong was that cord. Some women will fall after 1 month. It is very normal. As long as the cord is clean and there are no dirt. Yeah, if it's clean, no dirt, and the chlorhexidine is over, it is still okay. Just normal cleaning of the cord with warm water as you bath the baby. It is normal. It means that cord was strong. That's why it has not yet fallen. Any other question? Yeah. And I trust that everybody was taught on how to do a cord care on the baby, on how to clean the cord. It was well demonstrated. If you delivered at Jacaranda, it was well demonstrated to you on how to wash the baby from head to toe and how to take care of the cord. Best time to get family planning after delivery. Okay, immediately you deliver, we expect you to abstain until 6 weeks from the day you delivered until you are 6 weeks post delivery. That's until you start the vaccination of your baby at 6 weeks. That day is the day that you should come and start family planning. That is the best time recommended by World Health Organization. That is 6 weeks. That's the answer. My due date is 6th April. I did a scan and it shows I'm due today. When is 6th April? And today is 10. 1 month. This means that the date you gave, mostly check on the date, the period date you gave to the sonographer, to the doctor who did the scan to you. The date that you gave. Check whether you gave a wrong date. Alternatively, we'll do comparison of all scans done during this pregnancy so that we don't delay this baby to be born. So you come for checkup, you carry all the scans then we do our own calculation. Depending that you are told that you should be delivering today. If you check like today is 11, and you say your due date is 6 April, almost 3 weeks apart. 3 weeks days, that is a very long disparity, and we are guided using the knowledge that we have and checking on the abdominal growth using a tape measure. We will come with conclusion on when to deliver this baby. So I will encourage you to walk to Jakarta Power West. Today we have gyne until 4 p.m. Be checked by gyne, and then you plan on which day is best to deliver you according to the calculations. Remember to carry all the scans done in this pregnancy and your antenatal booklet. Wow, any other question? 10, 15 minutes remaining. Okay, is it okay to take Promiba gummies? Does the supplement have all that is needed? It is okay to take Promiba gummies, but does the supplement have all that is needed? It does not have calcium, but it has iron. You can take Promiba gummies, but you can take separate iron, separate calcium, especially in the morning. Then Promiba gummies, you take them in the evening. Does, what is this? Aroha. Aroha medicine. Aroha. Does aloha, I don't know, there's another question I'm not understanding. Does aloha, what is aloha medicine help HB Ibadan? Okay, I don't know aloha medicine what it is, but for your HB to get high, you need to take greens, cereals, vegetables. Then we take the prenatal supplement to maintain the blood level. You take the prenatal, and then you do the nutrition part, greens and vegetables and cereals. Then don't forget of fruits that contains more of vitamin C, like oranges. Those itasaidia the HP ipade. I don't understand the aloha medicine, what that one is. Another question, does 9 weeks 2 days and having on and off cramping, does it mean labor is near? Wow, this might be, it might be a sign of labor. It can also be a sign of urinary tract infection. So my question is, when was the last screening of urine done? If it has not been done for the last 1 month, can we check whether you have urinary tract infection? Alternatively, can we check whether it is early labor? If you are not in labor, we screen you for early UTI, that is infection of the urinary tract infection. You might be in labor, you might not be in labor, but you might be having the urinary tract infection. So I encourage you to come and check. It might be also forced labor. For you to know, you come for checkup. Wow. Continue asking questions as many as possible. Continue asking questions as many as possible. About the hospital, you can ask. We operate for 24 hours, Jakarta Power West. So you have now opened other new branches. We have other new branches at Ruaka, Umoja. Most recent, we have opened another branch in Gongbut. But us here, we are located at Jakarta Power West. Continue asking as many questions as possible. Okay, first scan shows 22nd March. Second said 18th. And the third was today. So you want to know which scan should you follow. So in pregnancy, we said you follow the earliest scan done in this pregnancy. The earliest scan done means the scan that was done, the first scan that was done when you got pregnant. You follow that expected date of delivery. So the earliest scan done, that is the first scan shows 22nd March. So we go with 22nd March. Best calcium to take when pregnant. All calciums are normal. They supplement at least 1,000 milligrams of plain calcium. So the best calcium is the one that fits with you. If you're okay with the aftertaste, you can take the one that you can chew. That is the chewable calcium. We have a tablet. You can decide to swallow. If you're okay swallowing, you swallow. If you don't feel like you can swallow, you can take one that has a soft gel capsule to swallow. So the best calcium is one that fits with you. If you have no energy to swallow, just chew. If you don't want to feel any aftertaste, just swallow. If you have the problem swallowing a tablet, use the soft gel. So it is according to you. If you want one that you can dilute it into water, then you swallow, just take. If you, after taking every medicine, you start puking, it means you don't swallow. You take one that you can chew, because if you chew calcium now and then vomit after 30 minutes, you don't vomit the calcium, because after chewing, the calcium goes direct to the body parts. How many kg should baby weigh not to go to NICU? At least any baby born between 2500 grams to that 500 grams is the normal birth weight according to World Health Organization. If the baby is born below 2500 grams, that baby should be admitted in the newborn unit for checkup. But after some minutes, if the baby is stable, you'll be given back that baby to your bed. If the baby is excessively big, that is above 4 kg, that baby should be monitored closely, but may not even be admitted in the newborn unit if the baby is okay. I am 36 weeks pregnant. My baby is in transverse position. Transverse means the baby is lying across. Should I expect CS or the baby will turn? So what we do when the baby is in transverse line, for a baby to be born, the head must be down. That is the downward position. Should I expect CS? Yes, you can expect CS, but before the CS is done, a scan should be done to confirm that the baby is still in transverse. When the baby is in transverse, you should not allow labor to take place. If the labor takes place and the head is not getting down and you are not dilating, you end up getting a uterine rupture, which is very bad. So we still have hope that the baby might turn. We have 2 weeks to wait. That's 6 weeks. We have to wait 2 weeks to wait to see whether the baby will have turned to longitudinal position. If the baby is still transverse at week 8, from there you can plan for CS. But on the CS day, that morning, we do a scan to confirm. Yeah, mostly there's a reason why the baby is still in transverse. Another question, is it safe to do elective CS at 8 weeks? It is very safe because the baby is already term. Term, we said it's from the 7 weeks and above. My previous scan was done from my belly, from my belly button going down. Then I have bikini cut the second time. Yes, you can have the bikini cut. The bikini cut is there. When the cesarean section goes across. Yes, nowadays we are doing the bikini cut. Yes, this is very possible. Mostly it was done from your belly button the first because it was emergency. It is the easiest transverse. It is the easiest CS to be done during emergency to save the life of the baby. But the second CS will be done in, as you are calling it, a bikini cut. 3 months pregnant, no appetite at all. What can I do to adjust weight? Don't worry, if you're 3 months and there's no appetite, but in the next 1 month, that is 16 weeks, the appetite will automatically come up. For now, I'll encourage you to take a lot of natural sugars from fruits. Just eat fruits. Fruits will stimulate you to take some just food, because fruits acts as a good appetizer, and we encourage mothers to take as many fruits as possible, especially in the first trimester. Please name the calciums. Calciums that we have. One, we have Ozical, Ossical are chewable calcium. So I mentioned some that are chewable. I'll also mention some that you can swallow. Like ossical is a chewable calcium. We also have trical. Trical is a chewable calcium. Okay, we also have osteocare. Osteocare comes into two types. We have one that you can chew, then we have tablets that you can swallow. We also have, those are three chewable calcium. That is ossical, trical, and osteocare. The one that you can swallow, we have osteocare tablets that you can swallow. We have also safecal. Safecal you can swallow. Safecal and osteocare. The other calcium we have is I think those are few I can remember, but we have others. We have others. There are many. If you come to a pharmacy, the pharmacist should tell you which are the ones that we have. But we have even the soft gel. We have tablet. We have the one that you can chew. We have others you can dilute into water first. But they come in different terms, different names. Other question? Can I take calcium at 35 weeks? Yes, calcium you can continue taking at 35 weeks, even after delivery. Deliver and take more 1 month. It is very recommended. You can take calcium 1 month after delivery because it will help you get more calcium. Remember, baby is sucking fresh breast milk after delivery, meaning it's getting a lot of calcium from your stores. So we encourage mothers to take calcium 1 month after delivery, just for good recovery and to ensure that babies are getting strong milk full of calcium. Between water that is injected and induction, which is increases pain and is it must? Okay, I'm not getting your question very well, but I'm sure you are asking about the induction of labor, where we use tablets, then we insert it from vagina to the cervix. I'm very sure you are asking about the tablet and the drip that we use. Now you are asking which is pain and is it normal? Which increases pain? That is the argumentation. So if I talk about the induction of labor, it is when there is an indication to stimulate labor to occur so that you can deliver your baby. Maybe your pressure starts getting high, or maybe you have been admitted for too long in latent labor, and then labor gets off, then we use a tablet to bring contraction so that you can deliver. That is when we call it induction of labor, and it goes into 3 phases. First phase, we insert the first tablet. We give you like 6 to 8 hours. If no labor, we do insert a second one. Then after 6 to 8 hours, no labor, we insert a third tablet. That's how induction goes. When you talk about the augmentation of labor, is when you are in labor, water breaks, it is clear, and the contractions are not adequate. That is, you are not getting pain, and water has already broken. What do? We do augmentation of labor, that is the drip. We add the oxytocin so that it can stimulate contraction. So this person is asking which is more painful. I don't understand which increases pain. Is that a must? Augmentation increases pain. That stimulates labor. Is it a must? It is not a must, but you can imagine when you are in labor, your water has broken, you are 6 centimeters, and there are no contraction. You cannot deliver that baby. So the best management is to start you on augmentation of labor. That is, you put normosaline and some drip and oxytocin, so that contraction can be stimulated for you to deliver your baby. Remember, when the water breaks, you have at least 18 hours to have delivered that baby, And also remember there's a graph monitoring. The graph should not end when you have not delivered. So we move with the graph. So it may not be a must. That is the answer. If you have contraction, we don't put you on the drip. If you are not on any contraction, we stimulate labor to occur. And that drip may not, if you are having contraction, we may not even put any drug in that drip. Sometimes we want to resuscitate the baby to give the baby more fluid. Dangers of not taking calcium. Good. These are an easy question. If you are not taking calcium, mostly, you will start experiencing joint pain, especially in the third trimester. Okay, another danger, if you're not taking calcium, you put your baby at risk of walking early. So the baby may have delayed milestone because we want this baby also to have bone development that are stronger. And these babies mostly will walk very early, like by the time they graduate 1.5 years, they have walked. We want their bones to develop. That's why we take calcium. Calcium is very important in pregnancy. So dangers is getting just joint pain, feeling weak, the baby's delays milestone like walking. You might even start having your tooth decays, your tooth shaking. Babies also might fail to have their first tooth appearing late. So let's take calcium, it's very important in pregnancy. Another question, I'm 7 months pregnant and meno inanisumbua. Quite very advice. Okay, I'll advise you to continue taking calcium. If you have not started taking calcium, please start taking. Take one that you can chew so that absorption occurs very fast. For that one, I recommend you to take one that you can chewable calcium. But if it is still difficult, you can see a dentist, but you will not be encouraged to extract your teeth when you are pregnant. But for now, just take calcium. I'm 6 months pregnant and I have not been taking any supplement. What can I start with? Please, you are ready. Start your antenatal clinic first. We screen you. We see how your HB is, that the blood level. You see how much it is. Then we advise you on the iron supplement to take. Iron supplement comes into different types. There are those with high iron uptake. So we'll give you according to the HB level. So you do your antenatal profile. We advise you accordingly, according to your blood level. I am at 6 weeks and I am swelling everywhere. What could be the problem? We said swelling of the body in pregnancy is danger sign in pregnancy. Especially now that you are at 6 weeks. Come for checkup, the Jakarta Rest will check whether your blood pressure is getting high. Swelling is danger sign in pregnancy. We have said any danger sign, you come for checkup. If at 32 weeks, the baby is 1.7 kg, is it possible they will be 2.5 upon birth? Yeah, it is possible. Just take normal fluid. You will need to see a nutritionist as well. 1.7 is not badly off, but I trust with good nutritional counseling, this is a baby who can be born above 2.5 kg. Don't forget, from week 32, the baby should gain more weight than it has been gaining. So nutritional counseling here will come for nutritional counseling. Then take at least 3 full meals, balanced meals. When you come to deliver at around week 39 or 40 or 41, the baby should have hit 2.5 kgs and above. Thank you for being my good clients. Bye. I wish you all the best.